Good night, everyone.
Good
We're
night,
live.
everyone. We're live tonight. We just wait a few minutes for everybody to log on. And we were trying to sort out Dr. Harris-Daley for coming on screen. So we have it. She's ready. Yes, she just put her picture there. She will not be live speaking to us tonight because she did not prepare the camera side of things. But we're going to have her here tonight um, to tell us and explain to us all the veterinarian questions.
Are they hearing
Are
us?
you hearing anybody? Are you hearing out there? We need to know if you are hearing us. If you can let us know. Chelsea, blessings and good night. Greetings, Mr. Bernard. Are you hearing me well? Clearly. Okay, that's good to know. And so I'm just waiting. Doc, she is um, she is online. Doc, are you hearing us?
Yes, I'm hearing quite clearly.
All right. So, Doc, I think you were saying you never used this type of platform before, like this one, but they will be texting us like blessings, good night. As you see, we're coming up on the phone, and our farmers and support will be asking us questions as we go along, and we'll be very um we will be well blessed to have you teaching us and letting the farmers know all the answer to all the questions that they have tonight. We're at about 17 people right now, and usually within about 10 minutes everyone, it usually gets quite full. So Doc, before we start, I would love, because we are now live, I would like you to introduce yourself, your name, and everything. If you can tell us something about yourself.
Okay, all right, no problem. All right, so as you know, the name is Dr. Roberta Harris-Daley. I've been a vet for the past 12 years. I started off in small animal medicine, that's really pets as well as horses. Went and did masters in cattle breeding and genetics in New Zealand, as well as a bit of small ruminant nutrition. And I now work with Hypro, right? So I am assigned the areas of Clarendon, Manchester, and St. Elizabeth, working with backyard poultry farmers, cattle farmers, and goat and sheep farmers, and
Okay.
also a bit of pigs.
A bit of what?
Pigs, swine.
Pigs. Oh, you also work with pigs. Okay, so you're all around in the um
Expert.
you're an expert, a jack of all trades in the animal husbandry and
Yeah,
veterinary.
well, hopefully jack of all trades, but not necessarily master of none. But yes, I am all rounded in terms of having dealt with pretty much most of the common species in Jamaica.
So Doc, you know what I am afraid of? I am terrified of kidding season. It it literally, I mean, it literally scares me, kidding season. Um, I mean, it is really very bad. I don't like feeding the kids. I don't even
Mm-hmm.
like the mothers having the kids. I don't like
Mm-hmm.
nothing about kidding season. Anytime kidding season come around, I get tense. So right now, a lot of farmers are in kidding season. So you can tell us, some things about kidding season and
All right.
your
So
experience. Yes.
first of all, in my own personal experience, having dealt with farm both cattle, small ruminants, and large ruminants, the first thing I'm going to say is going to sound very feminist, but I would say for farmers who have a lot of animals, especially during kidding season, you have a lot of animals kidding down, get a female worker, right?
Good
Females
advice.
tend to be better at nurturing young animals, and because a lot, for example, those who would have had the experience of having children, childbirth and all that, were more knowledgeable as it relates to what to expect and how to deal with things, and kind of can connect with the animals a bit better. So that's one of the first things I always tell people. Try to get
Yeah.
female workers if you have maternity as part of your program. So if you're buying animals and then just growing them out to sell, it's not so critical, but definitely if you're doing the whole reproduction breeding, having females is a must, right?
And I agree with you, Doc, wholeheartedly. Because my wife, she deals with this part of it, and I don't care about it any at all. The feeding the kids and the
Amen.
kids having issues, and oh boy,
Yeah.
I don't like it any at all. Anyway,
Yeah. So
anything else? Mhm.
yeah, man. So a couple of things just to remember, right? So kidding season, you have to prepare for it before kidding starts. So as most farmers would already know, nutrition before kidding season is critical for you to have a smooth kidding season. You don't want your animals to be too fat or too skinny because, as you know, the energy requirements for animals that are about to kid will vary from what it would have been for animals that just need maintenance. So you need to be aware of that. Have things on hand just in case you have issues like a dystocia. So you want to make sure that you have personnel there who are
This
knowledgeable of the
over,
wound.
you use a big word there. This what is it?
If you
Yeah,
This
dystocia. So it's yeah, dystocia. So basically it just means, for example, when you have a female that's kidding and she's having difficulties passing the kid, whether it is that it's in a breech position, meaning it's not coming out the normal way, or it's stuck because the kid is too big, or there are some other issues where she doesn't have the energy to be pushing, so she needs some assistance to get that kid out. So you want to
Okay.
have somebody, one, who is experienced, and two, isn't too squeamish, because a lot of farmers, when they first hear you're gonna have to go and assist her to get that kid out, everyone like, no, no, don't want to do it. But when they realize they have to, they do it and realize it's not as hard as it looks. It's just that you just have to get over that initial fear. So you have your gloves, you have your lubricants and all that, and ready and willing to assist if necessary.
Okay, Doc. Well, it's a little more than that because I have done it a few times, but I still, I'm not there.
not from you.
Yeah, man,
I don't,
definitely, definitely. It's not
I don't
something that you would
want to
just be
do
for
it.
anybody to do. But if you, for example, have a vet on the phone that helps to talk you through it, a lot of them can be done by hand. Mind you, there are some where honestly it would end up getting to the point of needing surgical intervention. But a lot of times, just you reacting quickly and being willing to follow the instructions and get that kid out, you will find that you can save quite a number of them, right? But as I said, there's no substitute for having actual proper professional intervention in some cases, because there are some cases where you just won't be able to do it.
I agree with you. All right. One of the first questions here is, what is the treatment for diarrhea in goats?
All right. So before I continue, I just want to make sure everybody understands that there isn't medical advice given over a radio interview or anything like that that can
Okay.
beat you having brought your animal into a vet or dealing directly with a vet, right? But I can just give you some tips and some ideas as to what could be the cause and what could be some of the treatment. So, for example, diarrhea. Diarrhea is one of the most common things that you'll encounter in your goats. I usually like to tell farmers, think about diarrhea. There are two main things, and then there are the other things that could cause it. The two main things that I find causing diarrhea out here locally is worms for one, and two, coccidia, right? So worms, majority of our farmers would already know about deworming your animals and how to detect when animals are likely to have a high worm burden and the different treatments for that, the different dewormers that are out there. So that would be what would be recommended in the case of worm issues, right? Additionally, coccidiosis is another big problem, particularly in the young kids, right? When you get diarrhea that's really severe, your animals are wormed out, you know for sure you're not really having a worm problem. That can also be another issue. And then there are different medications that can be used to treat a coccidia, right? So,
So, Doc,
yeah.
um,
hmm
I know you slide over the worm issues, right? But
Yeah.
we have
You
new
want to
farmers
focus on the worm.
here. We
All
have
right.
new farmers here, and we have, experienced farmers, and we have people who are not even farmers as yet, including international people, probably online with us plenty times.
Okay.
Quickly, give us a quick tip. Like, how would you identify if a goat is having worm issues? What are some of the signs?
All right. So normally persons who are experienced would use pharmacia as a means of telling. So basically you just look at the mucous membranes, which is basically you pull down the eyelid, the pink part, just like our eyes, you see a pink part and the white part. So you look at the pink part or what's supposed to be pink of the goat. And if it's looking white, more like chalk, you know your animal more than likely has anemia, which means that it probably has a very high worm burden. If it's more pink, then that's actually good. So you don't have to worry too much. Other signs that your animal may be having a worm issue is, for example, you're seeing a very shaggy coat. The coat's not looking nice and lustrous and shiny. That could also be an indication of worms. You can also look at the tail, right? So the tail, when you look at the tail of a goat, it should be nice and clean. There should be no evidence of feces on the back end. If you're seeing a lot of feces caking around the back end, it's likely that there is some evidence of diarrhea, and worms is also a possibility. The body condition of the animal as well, meaning whether the animal is looking really thin versus nice and round, could also be an indication of that, as well as what we call bottle jaw, which is a swelling below the, I'm sorry, I can't really show right now because I'm not on video, but just right below the mandible, that's the lower jaw, right? You'll see a soft swelling there. That could also be an indication that there is a worm issue.
Doc, that swelling under the jaw, because that's one of the questions I get a lot of calls about it. And some people tell me about the tongue, what they say now, they tell me they have something that the farmers sometimes tell me that the tongue stick out of their mouth. And that yes. See, I'm trying to remember what they say. They say that lose their cud. I think that's the word sometimes farmers use. I don't know if you have ever heard it, but if you can expand
All
on
right.
that.
Yeah, I have not actually heard that term, but I can get an idea of what you might be referring to. So, just a note, right? Swelling under the jaw, it doesn't always mean that it's a bottle jaw where you have a worm issue. Right. You can also have a swelling under the jaw because they have a particular disease, very big word, Caseous lymphadenitis, where they basically develop abscesses in that general area. It can make it very difficult to swallow. And then, as you say, you lose your cud, so they can't swallow properly. Sometimes you also have choke as an issue as well, where they're blocked up and then they can't swallow. And then again, everything comes back out. So it's not to say
Choker,
that
you
it's
said, Doc?
definitely, sorry?
Choker, you said?
Choke,
I didn't.
CHOKE.
Oh,
Yeah,
choke.
choke.
Okay.
Right. That's the term that we use for it. So when there's a blockage that happens, sometimes it
Oh,
may prevent them
you mean
from
like
being
food?
able to swallow and keep down.
You mean like food blockage? Like if they swallow
Yes,
something
so
and they
it can be food, or sometimes, for example, you may have them because goats like to eat everything. So sometimes they may actually end up like chewing on mango seeds, etc., and it blocks up the esophagus. That's a tube that runs from the mouth
okay.
down to the stomach, right? So
Oh,
that happens. It mostly happens in cattle, but I have seen a few cases in goats as well.
okay.
Right? So they're eating and they're just not able to get it down into the stomach, so they develop a choke. It's really swollen and nothing can pass.
Okay. Those cases you need the vet, right? Or any?
Definitely, you definitely do. All
All
right.
right. But the bottle jaw and when it's worm, you can treat them for worm. All right.
Definitely, you can do that yourself. Yeah.
Okay.
All right, so
All right.
just a little bit more, if you want me to go more into the worms, right? So just to
Yeah.
make it a little easier for the new farmers in understanding dewormers. So when you become a new farmer, you can get overwhelmed with the number of different types of wormers that are out there and the brands and all of that. I always tell farmers, easy way to think about it, there are really only three types of wormers, right? Just three. You have your white ones that look like milk. So whether it be strawberry milk or just regular milk, just has that white milky look, right? Those are your azoles, whether it be albendazole, fenbendazole, panacure, all of them, one group, right? Then you have your other type of wormer, which is the clear ones that you usually give as an injection or in the mouth. Those are the vermectin, so ivermectin, doramectin, all of those, same one group.
Right.
And then the last group would be the levamisole, the yellow looking ones that look like straw or urine, straw colored or urine. That's another group. So really only three types. So when you're doing your deworming, you've been using one type for a very long time, you try to switch to a different type. So a different color or appearance of your dewormers. Right, so
Okay.
that's just another little tip to remember.
All these 3 wormers are available in Jamaica?
All 3 types are available in Jamaica.
Okay.
And you have different brands, different percentage, concentration, all of that. So depending on which brand or concentration you buy, the dosage will vary.
Question. How soon after birth do you deworm a goat kid?
All right.
If the mother is given, will it also pass to the kids?
So how soon after birth do you deworm a goat kid? If the mother is given, will it also pass to the kids?
All right. So what happens is that we normally recommend that you deworm mothers during the time when you're actually meeting, as well as it is recommended sometimes as well to deworm them right before the kid if you have a really bad problem, right? And that way you prevent the worms from passing from the mom to the kid, because there are some worms that can actually pass in the milk. In terms of deworming kids, it's not usually a practice that's done, because the idea is that you would have prepared already to make sure that the moms, that's the dams, do not have worms to be passing on to the babies. However, in the case where you have a really bad issue, where you have your kid is actually having really bad diarrhea, you're seeing the pale mucous membranes, then yes, you definitely give your vet a call and they can tell you which dewormers to use. Most times it's what we call extra label, where the manufacturers do not recommend it, but the vet can give you advice to say, use this or use that at this certain concentration or for this amount of days to deal with the problem that you have at hand. But the idea is that your moms are supposed to be free of worms at the time that they give birth to those kids, so they're not passing it on. That's best practice.
And also, I don't know. I have farmers who, well, how soon after birth do you deworm a goat kid? So it's not a practice to deworm the goat kid after birth, or practice deworming of the kid, because I think that's exactly what he said. How soon after birth do you deworm a goat kid? You don't usually deworm a goat kid. You don't trouble the goat kids if they don't have a problem. Would that be correct to say?
That is exactly the answer. Do not trouble them unless they have a problem. That's not the normal routine
That's
at
not
all.
the norm any at all. And
No.
and if you have a strong, healthy mother and you do the Fermantia score and the animal has no issues, then you shouldn't really
Leave them alone.
Leave them alone, right? Drugs is not the
don't trouble you.
Don't trouble when I trouble you, right? We don't need to be drugging down the animals and have this feeling that, oh, I need to deworm them every week or every month or every 6 weeks or every 3 months or things like that. We also
exactly, because that's the thing. In the past, that was what was recommended. I'm not going to bash any farmer who is still doing that, because to tell the truth, as science and research has changed, things have changed. In the past, that was the recommendation. But now we have more knowledge. We know that that is definitely not the way to go. We do not deworm every one of your animals on a regular schedule. That is not what is recommended. You choose animals that need to be dewormed, and you deworm those specific animals when they have a problem.
Yeah, so you only deworm for problems. All right, Doc. So good night. Birthright. Good night. Oh, you read it.
From Chelsea, do you leave them until the kids show sign or
have worms? Do you leave them until the kids show signs of having worms?
All right.
I tell you the truth, Doc, I don't really usually see your kids at a young age showing signs of worms. That's not normal. But your comment, Doc.
Yeah, no. So what I'm saying is that, I'm not sure if the person didn't send that in before we answered, but what we're saying is that the idea is you make sure your mom is as healthy as possible and she doesn't have the worm issue to pass on to the kid, right? And that way you can prevent your kids from getting it. So as I said, it is not the norm for kids to be having a worm issue once you're doing everything correct, right? So you will see diarrhea in kids for other reasons. For example, coccidia. I did mention coccidia as a problem, right? You do have kids coming down with coccidia, especially if the environment that they're in is not very sanitary, right? So you need to make sure your sanitation is a must, because the thing with coccidia is that you can have adults that have coccidia and they show no signs, and they're passing it out in the environment, and then the kids pick it up and they get very sick with diarrhea. So it's just one of those things to be aware of. So you don't just say, okay, because I know I always have a problem with worms in my kids, I'm going to just deworm all of my kids. That's not the approach that you use.
Right. So cleanliness, you have to keep, especially when those young kids are born. So usually the mothers and so forth build up immunity to a lot of different things, but you have to keep that pen clean. Make sure you have, that's why we recommend the slatted floors and different things like that, just to make sure that those young kids don't get the problem. All right. So Doc, I'm also on the live, right? On TikTok. And it says, can I ask you a question? After deworming the mother goat, how long should the time period before you put her out to a ram?
All right. So when you're deworming, right, there really isn't any time period that you'd have to wait. Right. So, for example, if you have a goat that is having an issue why you dewormed her in the first place, for example, you realize that she's having the anemia and she's just not looking too great, you will want to give her time to recover from that. And that's when you will do the flushing, because you want to make sure that when she does go to the ram, that you're actually getting a good result. So if it is that you're deworming for a specific reason because she was sick, or showing signs of a bad worm burden, you will want to give her some time. So at least 2 weeks before you send her to the buck. All right. But so, otherwise, yeah.
No, I was just saying you use that big word there. Flushing.
Flushing, sorry. Okay, so flushing is basically where you increase the nutrition. Basically, you're feeding them a bit more, higher quality, just right before you actually send them to the buck. Right, that way you're basically increasing their chances of reproductive success, meaning getting pregnant with multiples for those who so desire. So that's what we call flushing. It's done in multiple species, not just in goats, but that's the idea of it. And then there's also one where we do right before they give birth as well, which we call steaming up. Right, so that is also another thing that can be done, where you increase the plane of nutrition right before they give birth, just to make sure milk production is good, the kids, because during that last phase of growth of gestation, that's when they're growing rapidly. You want to make sure you have nice, good, healthy, strong goat kids as well.
So flushing is something that you should
get. Flushing and steaming.
Yeah, but especially with flushing now, like sometimes you just take off the kids off the mother, and you have to bring up their condition, make sure that they have a good score, and make sure they have everything is great. I always like to say, make the coat look nice, and make sure the health conditions are there. So this
make
question,
them look pretty to go to the book.
Make them look pretty, yes. When the ram, yes, you'll fall in love right away. Mr. Bernard, good evening. I got me a beautiful ram kid today at 1:45 p.m. He is strong, but his left leg has a little fault, like a knock knee vibes. Just the left leg though. I don't know if that's a question or a statement. Any comment, Doc? I don't know what to say.
All right. So quickly, I'll just say that yes, you do have sometimes you have what we call congenital malformations in the legs when goat kids are born. It can happen because they just formed badly in the womb, and sometimes it's also because of delivery. Right. The majority of them, whether valgus or varus, just two big words just to describe how the deformity would be. A lot of them will grow it out as they get older. Right. So if they're able to walk around, stand, they're not showing any signs of pain, etc., I wouldn't worry too much about it. I do have to note though, sometimes you do see that and you'll see a swelling around the knee. It could be the start of joint ill, which is another thing that can affect your kids, and you need to be very careful about that, because if it's not treated early, you can end up actually losing your kids. It's an infection that happens right in the joint. So right around, for example, the carpus, that's the front knee joint or the back knees, you'll see it gets very swollen, painful. The animal doesn't really want to walk around much on it. So that is just another thing just to be aware of. All right.
A question here on TikTok. I have a goat with a cut on his ears and pus coming out. What can I put on it?
All right. Again, medical advice. I'm going to give over But I'm gonna say though, for generally when you have wounds on your animal, like just minor wounds, if even if it has a bit of pus, once the animal is still eating and drinking well, not having a fever, etc., then just doing topical, meaning directly on the wound, is good. So you clean it up as best as you can, right? So you can use your iodine, your hydrogen peroxide, etc., clean the wound as best as possible and dress it. I prefer dressing with Ectoline just because it has the fipronil in it, which helps to prevent the screw or maggots from getting there and causing more problems. All right, but generally for wounds, that is the basic first aid. All right, you don't
What
need to
about
go to give an injection with antibiotics and all of that drama. Once your animal is still eating and drinking, you deal with the wounds immediately and they should be fine.
what about combining two wormers? Farmers always telling me that they use two different wormers and three different wormers, and at the same time, and and
All right,
sometimes the vets tell them that, and they see it on YouTube and they see it all over the place. What's your recommendation?
my recommendation is one, do not move to doing a combination of dewormers unless you know for sure you have a resistance problem on your farm. Easy way to know you have a resistance problem on your farm, collect a fecal sample, send it into the lab. I'll just let you know here that Hyper actually does this for free for our farmers. So if you're a Hyper customer, you buy Hyper feed, you do get this service done. So you check to make sure that you actually have a resistance problem before you do combination, right? So that's one. The next thing is if you are doing combination, let's say you found out you have a resistance issue, you're doing a combination. Doing a combination with, let's say, fenbendazole and albendazole is not really a combination because, as I said, they're all in that same class. If you're doing a combination, it needs to be two out of the three different groups I mentioned before. So, for example, ivermectin with a fenbendazole, so milk with water, or milk with urine, or milk or water with urine. All right, so that's just something to note. But I do not recommend combinations unless you know that you really do have a resistance problem on your farm.
All right. Chelsea said, got it. I have a few issues with kids and worms. So they say they understand. So on TikTok, what about them having coal? What recommend to use? Thanks. Well, the questions are coming, Doc, so I have to ask them, and you just.
Yeah, man, I know. All right, so let me just say, all right, so cold is something that happens very frequently in your goats, right? Especially around rainy time and when the humidity goes up, right? So in some parishes right now, because we had a bit of rain, you will have your animals with cold. Cold can be approached just like how it is in humans, right? So the majority of colds, they are self-limiting, right? So what we'd call self-limiting just means that they will recover on their own with time. So just fresh air, holy person, eventually it will stop, right? So that's the most basic level. Sometimes though, the coughing, etc., they're not really recovering as quickly as you'd like, and it's affecting their ability to eat, etc. Then we would ask you to give something very mild, like an over-the-counter. There are some over-the-counter antibiotics, antiseptics that do work for those mild but not so mild cases. For the bigger stuff now, you will actually need to get a prescription from a vet for antibiotics as well as what we call antitussives. Those are the cough medicines, basically, to help prevent the cough and dry up the discharge from the nose and help get rid of whatever is causing the cold. All right. But there
Bron-
are treatments available.
bron-
Just depends on the level of it.
bronchitis also is another thing there, Doc. And I was also
No, man,
mentioned.
bronchitis is a part of it. So cold, when we say cold, bronchitis just means inflammation of the bronchioles and the bronchus, so the airways. So that is usually a part of it in terms of cold. So depending on the severity, you would use medication for that. So anti-inflammatories, the antitussives, and the antibiotics as necessary.
And the dust now, there's also another problem with dust, that dusty feet, or even sometimes the grass, a lot of dust can cause, sinus and
Definitely.
right. And
Exactly.
that,
And in those milder cases, as I said, fresh air, lots of sun, they can get over it on their own.
and there's also another, I don't remember, Doc, but sheep have this moth. If I don't
All
remember the
right,
name.
so nasal butts, right? So nasal butts, yeah.
Right.
So you don't normally see coughing with it. What you notice mostly is a discharge from the nose, right? So it's basically just like a fly larvae just laying in the nasal passages of the sheep. Thankfully, most times ivermectin works well for getting rid of that. Right. So if you're deworming animals, the animals have this kind of discharge, the butts usually respond to ivermectin. All right. So it's just a note. It doesn't mean that all the time you see it, it would be the butts, but it is something that does happen from time to time.
And it's an external parasite, I would say, right?
Yeah, it's a fly. So that's what I said. It's a fly and it lays larvae right there in the nostrils, and those larvae are actually what causes that discharge. So similar to a screwworm, where you have the fly laying eggs and the eggs develop into the larvae, a similar thing happens.
And usually I think is, well, and not to talk about the drugs, but it's one of the ivermectin groups of drugs. This question, how many weeks before the mother have kids should I deworm? As we said before, you shouldn't really be deworming unless it's absolutely necessary. So there is no weeks, there's no weeks that you should be deworming the kids or the mother any at all. You only do it if it is needed. And that's correct, right, Doc?
That is absolutely correct. Only if necessary. And if you do have to do it during pregnancy, we normally recommend that you use a fenbendazole. All right.
All right.
So just a note there.
Yeah, what question?
What are the signs?
What are the signs of coccidia?
All right, so coccidia, as I explained to you before, it's similar to worms in terms of seeing the diarrhea, right? A lot of time with coccidia, the diarrhea looks more mucoid, meaning you can see mucus in the droppings, so it looks a little shinier and more clumpy. But that's not to say that that's the only thing. Sometimes as well, you may see a bit of blood in the stool, right? But again, it's not definitive. So you can't just look at it and say, oh, it's definitely coccidia versus worm. You usually have to do a test, as I said, a fecal, and we will give you your results and let you know if you have a coccidia problem or you have a worm problem.
All right. Peter here saying worms and worm are all family, needs to be treated at the same time and wash everything and treat 3 weeks later. Any comment, Doc? You want me to read that again, Doc?
That's exactly what I'm doing.
Oh, you're doing it. Okay, no problem. Mm-hmm.
And treat 3 weeks. All right, I'm not really exactly sure what he's saying, but I suspect he's talking about treating the environment. For example, if you have animals in a slatted floor raised pen, that you want to try and treat the inside of the pen. I'm not exactly sure, but normally disinfecting, unfortunately, for some of the worms, it doesn't actually get rid of them, which is why we say you try to prevent them from eating anywhere that they would have pooped. So slatted floors is one of the reasons that we do that. I just want to mention at this point as well, because I've seen it at quite a number of farms, when you have slatted pens, like slatted floor pens, if the animals have access to the underneath of those slatted floor pens, you're defeating the whole purpose of having them in the first place. Okay. So when the poop and the feed and everything falls through underneath and the animals are going under there, they can pick up at the exact same thing that you were trying to prevent in the first place. So just making a note there.
Very good advice, Doc. Very good advice. So the Peter is also saying you need to isolate the female 3 weeks. Good night. Cleaning the pens, which we all said. I don't
do the dulling lactation.
Dulling lactation, I don't know what that is.
Or deworm during gestation.
Yeah, they're saying that they don't deworm during gestation, and that's perfectly fine. As we said before, it's not something that you absolutely need to do unless it is necessary.
Okay.
All right, meaning you have a problem.
All right, is Mr. Boucher this?
Good night.
Mr. Boucher say good night to us. I'm sure this is Michael though. Doc, how many diseases are here in Jamaica in goats?
Very good question. All right, there are the diseases that we already know about, which probably are in the hundreds, and then there are others that we suspect are here, but we haven't tested for. So lots of them.
That's a good. All right.
Lots
what is the best
them.
treatment for CL in goats and sheep? CL.
All right. CL is Caseous lymphadenitis, right? So I had mentioned that before about the abscessation that you'll see. You have the swellings under the lower jaw. Sometimes you'll see it under the armpits and all over, just basically in the lymph nodes. CL generally, it is one of those things that it is very difficult to treat, right? Because no matter what treatments are recommended, the chances are it will still remain with the animal, right? So persons have suggested and vets have suggested various things, but it is still one of those things where we say that there is no set cure for it. So different things like using formaldehyde in the wound, just draining all the wounds, all of that. So with CL, the real thing that you need to do is try to keep it out of your herd as best as possible, because once it gets in, it can spread very quickly, and you don't want that.
Very
Right.
con
So, and note for persons who have goats with CL, you have the abscessation. Sometimes you're tempted to cut it open and drain it out. If you're doing that, do not do that in the pen, because what you're draining out, it has all the bacteria in there. An animal goes and steps in it, you have that animal contract, and it's just chaos. So everybody soon have it. So try to control as best as you can. On some farms, they actually cull animals once they show signs of CL, because they don't want it to spread to the rest of the animals. All right, but it's one of those things you manage rather than try to cure. And by manage, I'll mention that yes, animals can live with it. You can have your females, they reproduce, they have their babies, they grow nice, good babies, and they have this problem with CL, but it's not life threatening for them, while others will actually end up passing because of it.
This question here says, my kid got sick, got him back. Now he's moving slow. I don't even know what that means.
Can you eat
All
the
right.
meat of an animal with CL?
Yeah, go ahead, Doc. Any?
All right. I'm just gonna assume that the animal was sick, so no, he's not near the point of death anymore, but he's still not back to his normal self. And in that case, depending on what the sickness is, it could be that he's still not fully recovered, but it could also be, for example, in the case of worms, where yes, you've dealt with the issue, but they still have a lot of recovering and recuperation to do. In that case, we normally recommend one, a higher plane of nutrition, just to kind of help them get back their energy, using vitamin and mineral supplements, replacing iron that would have been lost to help rebuild red blood cells, all of that. So just like with us, when you have had surgery or you're coming out of an illness, you need to make sure you kind of boost up yourself a bit just to get back your energy and get back to your normal self. You will have to do that with your animals too.
Can you eat the meat of an animal with CL?
The short answer is yes. However, normally with that sort of thing, because to tell the truth, public health inspectors are supposed to be involved in the inspection of slaughtered animals. Parts of the animal that would have had the CL would have been condemned and cut away from the rest of it. So,
Okay.
short answer is yes, but with conditions. All
So
right. It
this
also depends on how many different lymph nodes have been affected by it and all of that. So there are a lot of little things that persons are trained to recognize to say whether we condemn the whole carcass or just parts of the carcass, etc.
so Rankin here asks a question that is not for us. Is the government giving any help with people who are trying to go into the goat business?
Of
Well,
course.
yeah, I see the government giving a lot of help all the time through RADA and all the different entities. But your comment on it, Doc.
No, that's exactly it. I agree with you. The government is doing a lot. It's just for you to one, go get registered with RADA and find out what is available, what is out there for farmers and persons who are interested in getting into it.
And
And
the
one of the
small,
things I'll also mention is that a lot of people get into the business and then ask questions after. You don't want to go and buy a bunch of goats and then ask how to take care of them. You want to make sure that you get your information. You're going to hyper talk to the vet, you talk to other goat farmers, you go and you read and make sure you have at least an understanding of what raising goats are like before you go and purchase them, because they're not cheap.
Doc, remember you join up with the Small Ruminants Association also. Because Doc, you know,
Definitely, definitely.
because Doc, you know what happens? I just like to tell all of you, we work alongside with a lot of vets in Jamaica, a lot of nutritionists, a lot of people like this, the Small Ruminants Association. We put on training seminars. Doc have been to our training seminars, and we have a lot of great people, high pro, that really help us to educate the farmers. And the government entities are there, right there with us, alongside
Exactly,
with
that is very
fathers,
true.
everybody. And the government, even the AI programs and free AI, with some farmers. Different things are happening, maybe it might not be happening at the pace that everybody wants it to happen, but the government is there pushing the small ruminants industry a lot, and that is a fact. All right.
Definitely, because right now that is one of the priorities of the government, small ruminant development. So in addition to certain crops, small ruminant has been pushed as a forefront thing. So goats definitely is at the forefront of the mind of most government officials. So as you mentioned, Small Ruminant Association, a lot of resources there. So if you just seek out, you can get the information, you can get the resources, and you can find out exactly what is available to assist you in getting your thing going and going well.
All right. So Mr. Boucher here is asking AI VRS versus RAM to use. I don't know what that means.
All right, so I'm assuming he's talking about natural mating versus AI. I'm not sure what the question is, though. Are you asking which one is more expensive? Which one makes more sense? Not really sure what exactly you want to know about the two. But just so for the, you mentioned that you have some persons who are new. So I will
Mhm.
just explain the difference. So ram to you or doe to buck in the case of goats is basically where you do natural mating. So you bring your animal and a buck or a ram will jump them and mate with them, versus AI, which stands for artificial insemination, which is where through human intervention we would put the semen directly into the female, whether directly through the cervix going from behind or doing it surgically, where we actually make a very small hole in the belly and go in directly to the semen into the uterus. All right, so those are the two types, right? As you can expect, one is more expensive than the other, right? And different ones would be used depending on what your end game is in terms of what you actually want to do with your herd, where you want to see it going, and all that.
What can you do for a fully grown female that goes into heat but doesn't get pregnant
After
All
getting
right.
served.
after getting served? Yes.
All right. So there are quite a number of reproductive pathologies or diseases that can actually prevent a female from getting pregnant. Just like with humans, you'll have persons who will try for having a child and they don't necessarily have one, and they will require some kind of medical intervention for that to happen. Similarly, with goats, that can happen. If you have an animal like that, I would say the first thing you need to do is try to contact a vet to do a check on the animal to find out what her breeding soundness is. More than likely, an ultrasound would be necessary to see if there are any issues with her ovaries, any issues with her uterus, etc. So, yes, it does happen, but a lot of times there can be medical intervention done that will actually help with that. So, there are hormonal therapies and stuff that are available to help with that sort of thing.
And I will just make a comment too. When the young kids are young, you always want the best results. You want to grow out those kids, and trying to avoid sicknesses and trying to make sure the nutrition is very good. The first 5 months of the kid's life is very, very important for the development of all the internal organs. And if you don't make sure that that first 5 months is very, very good, healthy conditions, good nutrition, good environment, you can have abnormalities or what you'd say, like some of the organs cannot develop properly, for example. I've seen it, those things can affect the females
All
when
right.
they get big.
So yes, that is true, nutritional. But just to note though, most of the times when you have abnormal development with internal organs, that is usually something genetic or congenital. Yes, nutritional deficiencies, etc., can lead to that. Particularly, for example, vitamin E and selenium, very important when it comes to reproductive health. So you have to be aware of that. But just
Oh,
know that there are some other things that can lead to it, and some of them unfortunately are genetic. Your mommy had problems getting pregnant, got pregnant, you come around, you have the same issues as well. So just to know that. Unfortunately, I do have to go shortly. So what I will do, if there is one more question, I can try to answer that, but I really have to go.
all right. So there's a question. The last one I'll ask, Doc. Does Hypro do AI for goats? And if yes, how we go about getting it and
Get it
getting
done.
it done? And if there is semen
Are
are
from high
from high
quality
quality
farm
rams.
or buck.
All right. So yes, to answer the first question, yes, Hypro is in the process of getting our AI program off the ground. So as most persons would have known, we have done some training and we are continuing to do some training in AI, particularly as I mentioned, the surgical one, which has a higher conception rate, a higher likelihood of getting pregnant. Right. And yes, we do also have semen for sale, right? Semen from imported semen, that is from bucks overseas, right? From different breeds. You have the Saanen, you have the Kalahari, your Boer, etc. So we do have semen available, right? Most of it coming out of Australia, which has some really high quality goat over there. So we have that. In terms of accessing the program, I would say check back in about April, right? Where we hopefully should start advertising the services to have the surgical AI and possible trans-cervical, which is the regular going in from behind, right? We should have that available shortly. So just stay tuned.
Do you train anybody, doc, or is there any training or anything like that going on from your side? Like,
All right, so for surgical AI, it's only done by vets. However, for trans-cervical AI, no, we haven't started training other persons, but that is definitely in the pipeline.
okay, doc.
All right.
All right. So,
Yeah.
doc, thank you so much for, and I know you only said you would stay for a short time tonight, but thank you so much for your time. It was
Yeah.
a
Not a
blessing.
problem. You're most welcome.
It was a
I
blessing
hope
to
I was able
have
to
you.
help.
Yes, no problem. It was a blessing to have you here, and it was great. A lot of knowledge, and I know everybody appreciate it. Thanks a lot, doc.
Yeah, man, not a problem. And thank you for having me.
All right, blessings. I'll try and, I mean, I'm not the doc and not the vet, but we'll just answer, some more of those questions if I can. I find it, I find it so hard to even open up a bank account in Jamaica. Haven't done that in a long time, so I don't know what it is like now.
Where? Okay. Is there a local
Is there a
goat?
local goat meat production manual available for reference? Is there a local goat meat manual? Well, rather have a manual. You can check with them, and they have a few manuals geared towards goat, and so we can check that next.
Who said that? Mr. Rankin say he's
I live in the United States. Would it be hard for me to join all these programs, and will I still get benefit although I don't live in Jamaica? Well, even being on this program, you can benefit for it. So all of our training programs are online. Usually we stream them live, and you can learn from it. It's not every single thing you are going to be able to benefit from abroad, but yes, quite a few things are there that you can benefit from. What should I give my goat after she have birth?
we usually give
Don't
ox.
they don't you don't have to give them anything. It's only if an animal is sick or there's something wrong, then you usually give them. So just make sure they have a good environment to have the kids. Next. What is the best dewormer medication you would recommend? Well, she named the three of them, the three family of dewormers early on. There are only three different types, she said, in Jamaica. All right. Good evening, Mr. Bernard. I need a trough cutter to buy. Any available? Yes, they are available. Kimberly Shaw. Good night, Miss Shaw. What's the best type of rabbit to buy and raise for meat? Well, usually they say the New Zealand white and the California, the mid-sized breed of rabbit. They says the New Zealand white is good, is a good modern instinct, produce a lot of milk, usually can rear, quite a bit of the kittens. And then you have some crosses that people have here in Jamaica, but medium-sized breed is what you really need to be rearing. So Mr. Bernard here in Washington, very informative program. Thank you, sir. Let me look if any questions on the TikTok.
Asking for a price.
Price for
You can
location.
just send us a.
Send me a message and we can deal with that. Some some persons having a problem that, you know, they think that this is advertising, but, you know, and people having a problem with that. But good night, Prince Cummins. Good night, Sir Bernard. Is there an outlet in St. James to register with the Small Ruminants Association of Jamaica? I would say that I just had a meeting recently. We want to automate this thing and do it totally online, that you can just register without any, because we don't really have a physical location as such. Our physical location is supposed to be Bodles, but we almost operate virtual. So we go all over the place, like have meetings in different offices. Sometimes we're at Bodles, at, you know, different places that we have our meetings, and, you know, face-to-face meetings, and we do it online, and we go different place to do our presentations. So that's how we are doing it. But keep in tune. We'll let you know. All right, my goat have birth on Wednesday and this week. However, I haven't seen the afterbirth. What should I do? Have the baby on Wednesday, today is Saturday. You know, in the wild, our goats sometimes when after they have the baby, they usually, and the afterbirth comes out, they eat it. And this is an instinct that happens out, you know, because I guess when they're out there and predators are there, they eat the afterbirth, so they don't leave any sign that the goat just had kid. So yes, I have seen the females eat the afterbirth all the time. It's.
What if it stayed long? If she's still alive, then
she's still alive. She's not smelling, you know, bad or stink or anything. Then you can know, you know. Usually it's okay.
So what are the things that slow down the kids' growth?
Nutrition. If you see, you have to make sure that the nutrition on the mother is very good. Minerals. I've seen an increase in minerals make the mothers produce more milk. Make sure you have good nutrition, and then the mothers will produce a lot of milk. And the mothers are producing a lot of milk, then those kids will grow very fast. Also, you should practice creep feeding. Like 2 weeks, you know, after 2 weeks or so, you can practice creep feeding the animals, and that assists them to make them grow fast and make, you know, they wean off from the mothers very quickly, you know. So the creep feeders, I think Hipro has a dedicated creep feeder feeding that I hear is doing well. As the president of the Goat Farmers Association, can you expound on some of the benefits the government offers to goat farmers and how we access those benefits? A lot of those benefits that are there from government is through RADAs and through those entities. Well, even through the Small Ruminants Association also, that the government through Food for the Poor, yeah, they gave us those wheat milling that was distributed all across the island. The government, I mean, I can tell you, Dairy Board, and, you know, I see they help all in the hurricane time. Farmers got, you know, board and, you know, zinc and all different kind of things. I see they give farmers water tanks. All different kind of things happens within the communities and within the cluster groups. I see a lot of different things. The government helping with a lot of things. They do training through the 4-H clubs. They're doing all of those things. So the government they do a lot in the farming communities. You just have to know and be involved, you know, with your associations and so forth to take advantage. Right. What can cause your newborn kid to live like a couple of hours or a day and then lost the goat kid? You know, plenty of times, sometimes these goat kid born and did you look and make sure that the kid is drinking milk from the mother? Sometimes the kid will born and you have to, well, every time a kid born and I'm there, I make sure that goat get the first milk within less than an hour after that kid born. It's very important for the goat to drink that colostrum milk and make sure, you know, and then you watch it and follow it up and make sure that kid can drink the milk, can access the udder. Sometimes the udder might be big and full with milk and you have to milk off some of it. You have to just make sure that kid is drinking the milk and can manage the breast.
What is it? Ayodele, do you have maybe a creep feeder?
Do you have a CRD? I don't know what that his question is. So a
Miss
question
From Kenneth Francis saw a question in the last
video about mastitis. There is a mastitis vaccine called
called BIMCO, used for preventing the development of mastitis bacteria, not for curing mastitis itself.
Okay. I didn't know that you have a mastitis. Is it a vaccine you said? No, I didn't know that. All right, so we are here now. I don't see any more questions right now, but I know Doc probably covered everybody's questions. And so we are going to sign out now because I don't see any more questions. It was great having all of you online. And I am going to try and another vet will come on at another time, and we will certainly, you can put all your questions together. Anything we didn't answer, we can certainly put them together and we'll ask the vet. So I'm going to get another vet to come online after this. And the last question, I buy something called bull calf from dairy a farm. It is okay for me to feed to bull calves and goats. Well, usually ruminants are ruminants. So cows and goats are very similar in how they deal with it. Do you creep feed design? Can you share? Yeah, we can, and yes, sir. We can share the creep feeder that they have. You know the formula. So Farmer Khalil, I'll ask him to do that for you, sir. It's from that company. Most of the time, the kids are born weak. Yeah, kids are born weak in farms all the time. You have to help them in the beginning. And once you help them, sometimes a day or two after, they get strong enough and they help themselves. And you can bottle feed also. You can bottle feed them, milk out, bottle feed. You have to do what you have to do to make those kids survive. Whatever it is you have to do, you do it to make the kids survive.
But make sure the kid don't get drowned.
Yeah, drown when you feed. So the thing is though, the same way you see the mothers feed the kids. If you see the mothers feeding the kids like every 2 or 3 hours, that's what you do. And you don't try to overfeed them. You just feed them till they stop and then you allow them. So bottle feeding, you know, and helping kids is a natural part of goat rearing. All right, everyone. So good night. And as usual, thanks for being here and good night.
Good night, everyone.